meeting is being recorded.
Good evening to one and all. Welcome back to the today's session. A very warm good evening to one and all. My God. Welcome back to the today's session. So today we have Dr. Reshma Kishore Solaskar ma'am, Assistant Professor in Department of Repertory from Pspm Mahila Homeopathy Medical College. Homeopathy in a case of cholecystectomy is the madam's topic today. We welcome you, ma'am. We welcome you all the participants. Session is all yours, ma'am. Ma'am, kindly start the session, ma'am.
First of all, I thank the team of Homoeopathy for giving me the chance to present in front of you. So, my today's topic is homeopathy in the case of cholecystectomy. You people are
Yes, ma'am. Session is all yours, ma'am. Kindly proceed, ma'am.
Okay. So today the topic is homeopathy in a case of cholecystectomy. So I think all of you are surprised that what is the meaning of this topic, that is homeopathy in a case of cholecystectomy. Cholecystectomy means removal of the gallbladder. So first of all, I want to give a little bit introduction about the gallbladder, that is cholelithiasis. Cholecystectomy is done when there is a gallbladder stone, okay, stone in the gallbladder. The modern medicine has the only one option, that is the cholecystectomy. So cholelithiasis, commonly known as gallstone. Gallstones are the hardened deposit of digestive fluid that can form in the gallbladder. So you know that what is the location of the gallbladder? It is small pear-shaped organ on the right side of abdomen, just beneath the liver. Gallbladder holds a digestive fluid that is called bile, which is stored in it before released into the small intestine. So gallstones are the stones that develop in the gallbladder or bile duct when certain substance deposit and become hardened. The gallbladder is a small pear-shaped sac located at right epigastrium region beneath the liver. So gallstones ranges in size from as small as grain to as large as a golf ball also, or you can say like a shape of egg also. Some people just develop single gallstone, while some develops many gallstones. So if there is any query, you can raise your hand, or we can discuss at the end of the session also. Gallstones are formed due to the metabolic factor, reflux factor, infective factor, and stasis factor. So metabolic factor, in short, I want to explain here as I'm presenting the case, but I want to explain a little bit. When a person, this metabolic factor, the ratio for the metabolism of cholesterol, it should be 25:1. But when this 25:1 ratio comes down to 13, 13 is the range of bile, and 1 is the cholesterol. To metabolize 1 molecule of cholesterol, 25 molecules of bile is required. When this get deficient, there is a formation of gallbladder stone. One is the reflux factor. You can see here the gallbladder stone, common bile duct, opens into the second part of the duodenum. Here at the same time, the pancreatic duct also opens into the second part of the duodenum. This is called as the ampulla of Vater. Okay. when this pancreatic duct juice refluxes back into the gallbladder, then there is a lysolecithin causes the formation of gallstone. Third is the infective factor, and if there is any stasis or obstruction due to the tumors or compression, the bile stasis, okay, and that leads to formation of gallbladder stone. Risk factor, female-male ratio is 3:1. Linked to the estrogen, use of birth control pills, hormone replacement therapy, more risk in the pregnancy. And age is 40 years. I think all third year students, they have studied in surgery, that 4F, fatty, 40, fertile female. Okay, these are the risk factors and more commonly occurs in the female only. And the other risk factors are obesity, if there is any familial history, lack of exercise, diabetic mellitus patient has the more chances of formation of gallbladder stone, intestinal diseases like Crohn's disease, hemolytic anemia, and liver cirrhosis. Or in this also find in the person who are taking the medicine for low cholesterol, lowering the cholesterol level. And the gallbladder stone also occurs when there is a they are in the procedure of loss of weight at short time. So what are the clinical features? 80% cases are asymptomatic. The people who are suffering with the gallbladder stone, they are unaware of that. They are suffering with the gallbladder stone. It remains asymptomatic unless it causes some partial or complete blockage. Like blockage means here you can see, okay, or the gallbladder, when it enters into the neck of the gallbladder, you can the patient feels the pain in abdomen, that too severe pain at night. And why night only? Because the lying down positions makes the gallbladder horizontal, and some few minute stones may go and get lodged in the neck of the gallbladder. So biliary colic pain, pain in the right upper quadrant, that is right hypochondriac region. Sharp pain that occurs suddenly and lasts for around 2 hours. Okay, it has a time that the pain will be last for 2 hours. After that, it will released by the vigorous contraction of the gallbladder, and the stone falls back into the gallbladder. If continues for more than 6 hours, then it may develop the complication like cholecystitis or pancreatitis. The pain may radiate to the back, right shoulder, between the both shoulder blades also. There is nausea and vomiting and gallstone dyspepsia. Now, this is all introduction about the cholelithiasis. I wanted to tell you before start of the case. Now, this is the case. A 40-year-old female patient came to consult me in 2016. This is the old case, 2016. And why I have selected this 2016 case? Because this is my first case of gallbladder stone, which itself has surprised me with its result. So presented with pain in right upper quadrant since 1 month, on and off. But the intensity of pain was more since 1 week. There is aggravation to touch and lying on left side. The pain was relieved by cold water, but vomits it after few minutes. There was also similar complaint of pain since 15 days back also, but took modern medicine, but got relieved temporarily. The pain was relieved temporarily. Past history, the patient told about the details of past history. At last, I have included the video. You can listen from her also. That is cholecystectomy done 9 years back, and family history, nothing abnormally detected. Next, physical generals have taken. Her hunger was intolerable. Appetite was increased, even hunger, even after the eating. So immediately after the eating, she used to feel like hungry. And she desires for only cold drink, cold water. Thirst for the 6 to 7 glass of cold water, feels better after taking the cold water only. Urine was clear. Bowels regular but loose motion, especially in the summer. As she was suffering since long this one period, as it is a chronic one, so she was getting usually the loose motion in summer season. Sleep was the refreshed one. Thermal aggravation, changes of weather. Whenever there is a change of weather, she is to get aggravated in general, and especially from winter to summer, that is hot weather, and better by cold open air. Mental generals, this I have, it is incompleted one. As patient husband was a military person, she has to travel other cities according to posting, and she develops fear to be alone in unknown city. And other mental generals, I will tell you orally that that is my observation. When she came to me, she was like jolly. She used to smile, okay, always like a happy-go-lucky lady. And when I started her case taking, so I observed that whatever I'm asking the questions, she used to answer me slowly. Okay, that on examination of abdomen, so on examination, the abdomen was slightly distended but no swelling, but there is a mark of previous surgical, that is open abdominal, this surgery was done in the right hypochondriac region. The surgical stitch mark was present. On palpation, tenderness present in right hypochondriac region. That was aggravation to the touch. So I started palpation. She refuses her hand. That is called the tenderness. So totality I have taken. Anxiety, whenever, as I told you before in the mentors, she develops fear to be alone in unknown city. Before that, she used to live with her joint family because of her husband's transferring postings. So only husband and wife used to stay. When husband goes for the job, she used to be stay alone, and that develops fear to be alone. Okay, so this is my short case. So after that, she showed me her report, that is of, you see, Lavanya madam, is it visible?
Yes, ma'am. It is visible, ma'am. Yes, ma'am.
Yes. Can you see here the report? That is on
Slightly
3rd December.
blur है मैम. Yes, ma'am.
Is it blur?
थोड़ा सा blur है मैम. Yes, ma'am.
Actually, it is a very old report, na? It has become blurred.
Okay. Yes, yes, ma'am.
Okay. So you can see here post cholecystectomy status. Okay. So post operative GB stump noted with 11 mm size calculus in GB's term. So this is my case where I shock. अगर यहाँ पे उन्होंने गाल ब्लैडर स्टोन निकाला है तो फिर कैसे हो गया? तो फिर यहाँ पे मॉडर्न मेडिसिन का भी लिमिटेशन आ गया ना ट्रीटमेंट में. दैट मीन्स दे हैव रिमूव द ओनली एंड प्रोडक्ट, एंड डिसीज का जो था वो निकाल दिया, बट द कॉज, द फ्लो, द पैथोलॉजी स्टिल रिमेन्स. So in the first, this one I have shown you here. Can you see this? Can you see this part?
Yes, ma'am. Yes, ma'am.
This pointer you can see here.
Enter, ma'am.
Here pointer, gallbladder stone, gallbladder you can see.
Oh, yes, yes, ma'am. Yes, ma'am.
This part. Okay. What is this? This part which is marked here.
Stick duct, ma'am.
Cystic duct, yes. I wanted to just confirm it whether you are seeing or not. So this cystic duct. So when the cholecystectomy is done, it was partial, okay, or subtotal it is. They used to remove this whole gallbladder, but this cystic duct remains. It is also called as Hartmann's pouch. Getting? When this Hartmann pouch, it is a remnant of gallbladder. Here there is a formation of 11 mm stone. Okay. So what the modern medicine can do here? Already the end product of the disease, gallbladder stone, they have removed the organ itself. But for what this part, what they can do? Here my title suits here, that is homeopathic in a case of cholecystectomy. Okay.
Yes, ma'am.
Yes. So this is the scope of homeopathy, that even after the surgical intervention, okay, we can give the patient the homeopathic treatment where the other pathy has its limitation. Okay, this is the, for confirmation once again, she did on the same day, 4th December. सच में है या नहीं, आई थिंक इट इज ब्लर फॉर यू पीपल. ओके, सच में है या नहीं स्टोन, सेकेंड टाइम उन्होंने अश्विनी हॉस्पिटल में किया, सोलापुर, बट अगेन शी गॉट द सेम impression, that is 11 mm stone in the Hartmann's pouch, that is cystic duct भी बोलते हैं उसको, और Hartmann's pouch. Okay. So can you make the repertory totality? I think most of the students are joined here.
Yes, ma'am. Respected participants, if you want to answer, ma'am, you can unmute and you can answer, ma'am. Yeah. I think we can have the question and answer session in the end, ma'am. Please continue, ma'am.
Yes, yes. Okay. So I have done the repertory totality. That is phosphorus. I want student to analyze this case. Can you see this? So I have taken the rubrics totality, that is mind, anxiety, alone when. She used to fear. वो घबराती थी जब वो अकेली रहती थी, क्योंकि ऑलरेडी जो जॉइंट फैमिली में रहते दे आर वेरी मच जॉयफुल. जॉइंट फैमिली में से निकल के वो अकेली रह गई, उसका वो फियर, उसका घबराना शुरू हो गया. सो आई हैव टेकन माइंड एंजाइटी अलोन व्हेन. Okay, so whenever we are analyzing, first we have to go with the ailments from or emotions. This is the one. I think एक ही upload हुआ है. One more is there. Mind. Okay, I have to add here, as at last moment, madam told me to add the repertorization also. Mind answer slowly. This is one more I have to add here. You can add here. The students, you can go for the repertorization. Mind anxiety alone when mind answers slowly. And third, I have taken stomach appetite increased eating after. That is hunger even eating after. Stomach pain, cold drink, amelioration. In beginning, I shown that the first slide. The first slide. Okay.
Yes, ma'am.
Relieved by the cold water. Okay. So I feel this intensity was very high. Okay. So I have taken the +3 intensity relieved by the cold water, because उसको modern medicine लेने के बाद में temporary relief होता है, but cold water पीने से उसको अच्छा सा relief होता है. That gives the intensity high. Okay.
Yes, ma'am.
Yes. So third one I have taken fourth one, that is generality change of weather. Okay, change of weather उसको aggravate करता है, especially the hot weather. But more it was more जब भी weather change होता है, he feels aggravated in generally. Okay, उसका अस्वस्थपना start हो जाता है. And last is उसने जो बोला था bowels में कि उसको especially summer में ही डायरिया लगता है. So I have taken rectum diarrhea, hot weather. So this is my totality. Okay, and the case was more marked. Okay, out of 6 totality rubrics, 17 was the highest. After only repertorization is the not only end. After that, you have to compare with the Metramedica. Okay, you can use any Metramedica. I have used the boric. So my final remedy was phosphorus. So phosphorus 30, single remedy I have given, single dose, okay, not repeated once also, as it is a deep acting also, long acting. So one dose I have given, that to 30, okay, and remaining all was PL 3 TDS. And I asked her to do the sonography after 3 months, okay, and she got relieved. Got relieved, okay, and I just want to show her testimonial. Lavanya madam, can you see the video?
Yes, ma'am. Yes, ma'am.
मैं अपना मेरा नाम कमरुनिसा मैन, मैं काजल नगर कोटकी रोड सोलापुर की।
Before displaying any video, I'll just tell you the norms that you have to take the patient consent that you are disclosing her video. So I have taken the consent and she is very open enough. She said that अगर इसका सभी स्टूडेंट्स को यूज होता है, कोई सीखता है तो मैडम आप जरूर मेरा शेयर कीजिए और नेम ऑल्सो वी हैव टू शो, ओके, डिस्क्लोज नहीं करना चाहिए, बट शी वाज नॉट हैविंग एनी दिस वन प्रॉब्लम।
2006 में मुझे गाल ब्लैडर स्टोन की शिकायत इसकी थैली में कम हो गई। तो मेरे हस्बैंड मिलिट्री में रहने की वजह से मेरा ट्रीटमेंट पुणे के कमांड हॉस्पिटल में हुआ, मतलब ऑपरेशन हुआ, जहां उन्होंने मेरी पिक की थैली निकाल दी। कुछ साल अच्छी रही मैं, फिर वापस से मुझे 2016 की फिर तकलीफ होने लगी। जब सोनोग्राफी करके देखा तो उसमें फिर से वापस कम कर हो गई। मैं अश्विनी हॉस्पिटल में दिखाई तो डॉक्टर ने कहा कि आपने जहाँ अपना ऑपरेशन कराया था आप दिखाई। मैं वापस पुणे हॉस्पिटल कमान हॉस्पिटल गई तो वहाँ डॉक्टर ने कहा कि ऐसा हजारों में किसी एक को होता है। जो थैली निकाल दिए थे उसमें थोड़ा सा कण रह गया था और वो कण बढ़ के कक्कर हो गए, तो इसको हम कुछ नहीं कर सकते, मतलब दोबारा ऑपरेशन नहीं कर सकते और आपको मतलब परहेज करना पड़ेगा और ये आपको अपनी जिंदगी भर साथ में लेके चलना पड़ेगा। फिर वापस मैं शोलापुर आने के बाद मुझे मैम रेशमा सोलस्कर के बारे में पता, मैं उनके पास गई और उनको अपनी मेडिकल हिस्ट्री बताई तो मैम ने कहा कि इसका इलाज हो सकता है। फिर उन्होंने मुझे 2 महीने की दवाई दी जिसमें उन्होंने पूरे कंकर क्रश करके दिखा दी और मेरी रिपोर्ट नॉर्मल, सोनोग्राफी में बिल्कुल कंकर दिखाई नहीं। अल्हम्दुलिल्लाह मैं आज पेशेंट फाइन। अल्लाह का, मैम रेशमा सोलस्कर का, जिन्होंने मुझे नई जिंदगी दी।
So this is the feedback of that patient. So, but till now, what's her fear? The nature of this phosphorus confirms here. Now, how she's speaking very slowly, okay, and it confirms that. So after 2016, okay, December, January, February, March, after that only 3 months she has taken. After that until now, that is after 2016, 9 years also, she did got a symptoms of any other complaints, कि ऐसा नहीं हो गया कि कुछ सप्रेस हो गया और दूसरा सिम्टम बाहर आ गया। तो this one I have taken recently video, okay, I think 6 months back, and it has confirmed the aphorism number 2, okay, that is annihilation of the disease. That's all. So this is my case. I thank you. I thank all India Homeopathic Students and Youth Association, and I thank special thanks to Dr. Arpana Parikh Madam, HOD Department of Repertory, Chandwad College, District Nashik. And thanks to Dr. Nivedita Patnaik Madam, National Vice President of AIHSAYA, and Dr. Katari Lavanya Sai, National General Secretary of AIHSAYA. And for the anchoring team also, Dr. Ashika and Dr. Aditi Malkhani. So I complete my this. I have completed my case. Thank you one and all.
Thank you so much, ma'am. It's quite a overwhelming for us to learn so many things from this case, and it was a quite useful too. With the consent of the patient, we have learned how to deal and how to repertorize and how to pick the points also.
Yes,
So, respected participants, if you have any
yes. Any
queries,
queries,
you can
any
kindly
questions, we can
comment
ask.
in the comment box so that madam will be answering. Yeah.
Any questions? You can raise your hand also if you want to ask.
Ma'am, I have a question, ma'am. Majority of the liver cirrhosis cases are all has a chance of landing of this cholelithiasis, ma'am.
Yes, that is the what when the liver this bile production occurs from the liver itself. Okay. Yes. So I want to tell here a little bit psychodynamic. Uh, that is psychodynamic is that whenever the liver metabolism disturbs, okay, the gallbladder disturbs here. Why? Because the psychodynamic is that कि यहाँ पे जब भी रिलेशन में कड़वाहट आता है, ओके, तब जाके कड़वाहट मतलब क्या है? सप्रेशन ऑफ एंगर ऑन लव्ड वंस. ओके, तो सप्रेशन ऑफ एंगर ऑन लव्ड वंस क्या है कि यहाँ पे लिवर, इट इज द व्हाट ऑर्गन ऑफ मेटाबॉलिज्म. ओके, उसका पूरा जब भी एंगर सप्रेस होता है डायरेक्टली इट एक्ट अपॉन द व्हाट स्टमक. जैसे ऐसे बोलते हैं ना, मेरा पित्त खवड़ गया, मतलब ऐसे गुस्सा आना. और जब भी गुस्सा आता है तो उसने एक्सप्रेस नहीं किया, उसको दबा के रखा. एंड दबा के रखा, द एक्शन टेक्स प्लेस, द फिजियोलॉजी से पैथोलॉजी में चला जाता है. बट इट इज फॉर द लॉन्गर कंटिन्यूड पीरियड में रहेगा तो हो जाता है. दैट इज hyperacidity, indigestion. ओके. और लिवर इज द सेंटर प्लेस. ऐसे बोलते हैं ना, तुम मेरा कलीजे का टुकड़ा हो, है ना. और जैसे अभी लिवर इज व्हाट, कलीजा. तो वो कलीजे का टुकड़ा हो तुम. तो कलीजे का टुकड़ा कौन रहता है? अपना बच्चा रहता है, अपना बेटा रहता है. अगर समझो, अगर बेटा बच्चा अपना बार बार अपने पेरेंट्स का इंसल्ट कर रहा है तो वहां पे एंगर सप्रेस हो जाता है. दैट इज ऑल्सो द वन ऑफ द कॉज. और थर्ड एक रीजन ऐसे है जहाँ पे एंगर सप्रेस हो जाता है. और पेशेंट जो नॉर्मली फाइनेंशियल जैसे क्राइसिस में जब आ जाता है, क्राइसिस में आने के बाद में वो पूरा अभी ऐसे सोचेगा कि जैसे पहले भी नॉर्मल खर्चा करता था, अभी वो उसको क्या कर रहा है, माइजर, उसको इसमें माइजर लिया जाता है. मतलब अब उसको पैसे बचाना है. तो बचाना बोले तो क्या है, साटना है. साटना बोले तो क्या है, और उसके ऊपर से एंगर सप्रेस्ड है तो उसका पूरा मेटाबॉलिज्म बिगड़ जाता है. तो साटना इवन गाल ब्लैडर स्टोन में भी आएगा और रिनल स्टोन में भी आता है. तो साठा जब होता है तब वो फॉर्मेशन ऑफ स्टोन हो जाता है. दिस इज व्हाट आई हैव अंडरस्टूड द साइकोडायनामिक ऑफ दिस गाल ब्लैडर स्टोन.
Ultimately, suppression of that anger will also be
Yes,
affecting that liver,
yes, yes.
Jessica.
So liver is the
Yes,
center
yes.
of metabolism ना, वही
हाँ
बिगड़
जी,
गया. हाँ.
हाँ जी, ma'am.
Yes.
Yes, yes, ma'am. Any other question from the participants?
Yes. Someone is asking question.
Yes, respected participants, you can kindly unmute and you can ask a question to ma'am.
Hello, ma'am.
Huh?
Hello, ma'am. Mansi Shinde speaking. Ma'am, I have a question. मैम जब सर्जरी के बाद गॉल ब्लैडर रिमूव किया जाता है तो डज एनी फॉर्म ऑफ वाइटल फोर्स या जो हम बोलते हैं कि उनकी डिसीज से लड़ने की जो कैपेबिलिटी है डज इट गेट लॉस आफ्टर सर्जरी बिकॉज रिमूविंग द ऑर्गन तो ससेप्टिबिलिटी इफेक्ट हो जाती है कैसे?
ऑलरेडी हो चुकी है उसकी ससेप्टिबिलिटी इफेक्ट। अभी देखो यहाँ पे गाल ब्लैडर को निकाला है, हिटिंग, बट उसके कॉज को नहीं निकाला उन्होंने।
Yes,
एंड
ma'am.
प्रोडक्ट एंड डिसीज है, तो उसका वाइटलिटी अभी भी नेगेटिव में, नेगेटिव डायनामिक इन्फ्लुएंस में ही है।
Yes, ma'am.
अच्छा, तो यहाँ पे क्या है, जहाँ जिस वजह से जो रीजन था सप्रेस ऑफ एंगर, तो हमारा मेडिसिन से क्या होता है, वो एंगर एक्सप्रेस, अगर पर्सन एक्सप्रेस करते रहता तो गाल ब्लैडर स्टोन होता ही नहीं ना उसको।
Yes,
तो
ma'am.
हमारे मेडिसिन से क्या आता है, वो सभी सप्रेशन निकाल देता है और वाइटलिटी को सिर्फ स्टिमुलेट करने तक ही हम मेडिसिन देते हैं। और
Yes,
बाकी जो फिजियोलॉजिकल प्रोसेस होता है, जब वाइटलिटी स्ट्रांग हो जाता है, डायनेमिक नेगेटिव इन्फ्लुएंस जो रहता है उसको पूरा निकल जाता है, बट इन द फॉर्म ऑफ एक्सप्रेशन डिस्चार्जेस। इसलिए उसको ना डिस्चार्जेस भी है, देखा ना, वॉमिटिंग भी है, ओके,
Yes, ma'am.
और डायरिया भी है, ओके। तो ऐसे निकल जाएगा, तो रूट कॉज यहाँ से निकल जाता है।
Okay, ma'am. Thank you, ma'am.
Any other question? Any other question?
मैम एक्चुअली जैसे आपने बताया था कि सप्रेशन ऑफ एंगर इज द मेन रीजन विच इज द फॉर्मेशन ऑफ दैट सच गाल ब्लैडर। एनी अदर कॉजेस मैम, लाइक साइकोडायनेमिक कॉजेस?
यस, बोला ना, सप्रेशन ऑफ एंगर फ्रॉम द लाउड वंस एक आता है, और दूसरा जो है, जो फाइनेंशियल मतलब क्या बोलते हैं, क्राइसिस में रहता है, ओके। डोमिनेशन इज वन ऑफ द रीजन, डोमिनेशन की वजह से भी होता है, ओके। और हाँ, रिश्तों में कड़वाहट आने से, ओके। एंगर सप्रेस, क्योंकि अभी देखो लव्ड वंस कौन है, हस्बैंड एंड वाइफ है, तो अभी वो अपने हस्बैंड इज अ लव्ड वन बट शी कैन नॉट एक्सप्रेस, एग्जाम्पल में बता रही हूँ, हस्बैंड इज अ लव्ड वन और उसको गुस्सा तो आया है बट उस पर नहीं निकाल सकते। एंड व्हेन लव्ड वन इंसल्ट, अगर समझो कि कोई लव्ड वन इंसल्ट करता है तब भी एंगर सप्रेस हो जाता है, ओके। एंड फाइनेंशियल क्राइसिस, इट इज ऑल्सो द वन ऑफ द रीजन, एंड रिश्तों में कड़वाहट, ये चार रीजन हो सकता है फॉर द फॉर्मेशन ऑफ गर्ल्स।
अच्छा,
Okay.
yes ma'am. Any other question from the participants?
Yes. इन टाइम में हो गया लावण्य मैडम?
Yes ma'am. Yes ma'am. So I think the participants are also clear with the topic ma'am, and thank you ma'am, thank you so much for the in detail explanation. So
I think now camera is visible.
Now it is visible, ma'am, at the end part. Yes, ma'am. Yes, ma'am.
अंत भला
Uh,
तो सब भला. Okay.
yes, ma'am. Thank you, ma'am. Thank you so much for the in detail explanation of the topic. And thank you, all the participants. And thank you all. So, tomorrow we'll be meeting with the another topic pertaining to the nanoparticles in homeopathy by Dr. Suraj Singh sir. So kindly, that is a new topic. Kindly hope you all register for the session. So the updates will be given in the Telegram and Instagram as well. So kindly check it out and do the registration as it is of mandatory. So thank you all. Thank you so much. Thank you, ma'am.
Thank you, Lavanya.
Thank you, ma'am.